This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.
Dr. Tom Roselle live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. Yes, we're live in studio on an absolutely stunning, gorgeous Washington Day. And by the way, happy Mother's Day, everybody. What a beautiful day to celebrate you. 888-630-9625. That's 888-630-9625. Love to have you call in and talk about anything. We've got a topic, and one that truly is one that affects hundreds of thousands of people without any accommodation except for surgery and injections. And trust me, that's not the way you want to go with this thing. What are we talking about? We're talking about carpal tunnel, tingling in the hands, hand and arm pain, anything that makes your hand weak or numb or atrophy or it seems like arthritis, and it's many other things. We call it carpal tunnel, but in studio I have an expert, somebody that is near to dear to all of your hearts, somebody who is an expert in neurological problems, Dr. Harlan Browning. Hey, Doc.
How you doing, Tom?
Okay, man. It was nice driving up here today.
It was beautiful driving up here. It was a great opportunity to catch up outside of the office as well.
Put the top down on the car, relax a little bit. It was cool.
Very good.
Listen, this is a great topic because, driving up in the car, how many people put their hands on a steering wheel and their fingers go numb, or their hands go numb, or their forearms go numb, or they feel weak, or they can't even grab a hold of something, they let it go and they drop things out and they think, oh my God, it's a neurological problem from the brain. Well, not so much. Talk to us a little bit about this. How common are hand, finger, forearm type of conditions relative to their presentation? Then we're going to talk about, obviously, what they are, how we get into them, and, what happens.
Well, I think carpal tunnel in itself, a true carpal tunnel syndrome, which is a compression of the median nerve in the wrist, is not as prevalent as we would like to think it is. I mean, it's grossly overdiagnosed, but certainly numbness and tingling in the hand and the arm, weakness of the hand, very, very common, but there's multiple entrapment sites where it can happen, anywhere from the neck all the way down to, yes, in that carpal tunnel. So very common thing that we see, certainly something that can be referred from areas distal to it, and it's, it goes above and beyond doing things that are active with the hand. I see a lot of folks, probably more people, who complain of arm numbness or hand numbness just from sleeping than from doing an activity.
It's funny, we talk about repetitive stress injuries as it relates to this specific topic and people who have their hands on mouses all the time, but here in today's society, with everybody running to their different devices, their electronic devices. You see kids sitting there, and they have these iPhones or their iPads, the mini pads, and they've got their thumbs on them repetitively going, like crazy. I can't go that fast on any of these devices. But it's not only a guy that's out hammering nails, or a guy that's shoveling, or a guy that, that is working as a bricklayer, but it's people like you and me that are using their hands every day, kids that are using their hands every day, people that are, that are detail, and it's just not from the hands.
No, and I think it would probably be more common in folks that do a lot of fine motor skills, typing on a keyboard, or an artisan using his hands in mobile positions, than it would be just the person that was swinging a hammer or turning a screw. So it's very, very common in people in an office setting, and certainly folks that have to work in a minute environment with their hands as far as constructing things.
This Wednesday evening, Dr. Harlan Browning will be your host, your presenter at the Roselle Center for Healing. What he's going to talk about? Things that make your hands numb. Carpal tunnel syndrome, repetitive stress injuries. And remember, neck, shoulder, arm, fingers. That's where it comes from. If you have a problem with this and you'd really like to figure out how to get it restored once and for all without surgery, without having to pay the surgeon's house payment for that month, here's your opportunity. Join us. Give us a call, 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to attend, and remember, our in-house continuing education programs, as we call them, are a gift to you, the community. There's absolutely no obligation. Come and find out what you can do, and sometimes it's just a matter of doing a few simple things on your own to turn things around. Love to have you as our guest, as always. Give us a call. 703-698-7117. Dr. Harlan, let's talk a little bit about how these things, we know that it causes numbness, it can cause atrophy. When I was in school and I started working on patients, at the end of 3 months, my thenar pens, my thumb pads, were gone. I mean, that muscle just underneath the digit of the thumb was totally flattened out. I had a carpal tunnel, a true one. And I looked at it, and fortunately, because of the work that we do, it was fixed, and it was fixed very rapidly. In those days, what we did, it was just straight up manipulation, ultrasound, and acupuncture. And I got my hands back, thank God. I was a young doctor starting out in a career. But let's talk about step by step what can cause it. Somebody says, well, my hands have been numb for a long time. I have to. In the middle of the night, I wake up, I shake my hands to get my fingers to wake up again, or I have to move my arms slightly. Do those movements tell you anything?
Yeah, they certainly do tell you a lot of things. Number one, you want to think about the pain pattern, the distribution, where exactly in the hand it is. If a person is just complaining of numbness in the whole hand, it's most likely not a carpal tunnel syndrome as the primary issue here, because that nerve specifically innervates or sends information to the thumb, the index finger, the middle finger, and sometimes portions of the ring finger. So if your pinky is numb as well as the other fingers, you're getting compression of several nerves, and it's most likely that in that pattern it's probably coming from the neck. I think one of the big things that we're seeing more and more now is nerves that are getting caught in the peripheral areas. That means in between muscles in the arm and muscles in the forearm. And that usually happens because people are just so dominant with their flexors. Those are the muscles that bend the arm up or bend the wrist up. Those muscles are so strong compared to the ones that extend the wrist that the nerves just get compressed over periods of time, and then all it takes is a little bit of activity, typing at the keyboard or, washing your car, just simple things like that, and then all of a sudden that nerve gets really dinged and it starts to cause the numbness and tingling or maybe even weakness.
The interesting thing, and most people wouldn't get this, but it's more common in women than men, which blew my mind. I was reading an article the other day in one of our journals, and I just pulled it up here a minute ago, that in most surveys, most studies, it goes from a slight incidence to a very significant incidence of women over men. Any clue? Any thought process on that?
I think that you could look at it two ways. Historically, women would be more in jobs that were typing, in the past, so that certainly could be an overuse injury. I think we also have to bring in their hormonal influences. Now, people are saying, well, what does that have to do with carpal tunnel? Well, if we have an overproduction of estrogen and not being opposed with progesterone, we have a tendency for women to hold water. Well, if we hold water and tissues swell, then we run the risk of compromising anything that goes through that area. So if it's a closed quarter like the carpal tunnel, and we have swelling in there on top of maybe some mechanical irritation just because we're typing, then we're going to have probably a greater likelihood. So I could see it being purely structural, and I could see it being pushed a little bit from the biochemical hormonal side.
The interesting thing is that women across the board, and sorry guys, it's Mother's Day and I got to give them my hats off on this, women are generally more physically productive on a day-to-day in their lives relative to activity than men are. They're moving around, they're lifting children, they're picking things up, they're doing laundry, they're working at the job, they're on computer systems, and today we have women who are laborers, from firefighters to police officers across the board. And it just is that. Women are far more multidimensional than men. So subsequently, you add what Dr. Browning just said to that situation, and that maybe steps up to the plate. The other thing that I just thought about, Dr. Browning, is that obviously women, we all have testosterone, estrogen, progesterone. Women have a lower level of testosterone. Testosterone, by its nature, makes muscles and tendons stronger. And maybe because of that low level as well, combined with the things that you just talked about, we have a greater predisposition as women try to do more physical things.
Sure. And then, we can certainly bring in some more of the chemical side of it as well. People who have a tendency just to be more inflamed because their diet is poor, that would be a big subset of folks that have carpal tunnel-like syndromes that they can't explain. And, if there's any kind of autoimmune type disorder as well that's not been discovered or hasn't been diagnosed because the symptoms aren't that profound, that could be, in the picture as well.
The other interesting piece is it happens more with age than it does with a younger person. And usually when you see it with younger people, in my experience over 37 years of practice, it's either with trauma directly to the spine, to the lower portion of the neck, or it's trauma to the hands. They've done something where they've in fact directly compromised that wrist, those fingers in some way. But as we get older, we have a tendency to structurally break down as well, and not necessarily by injury, but by posture. We start rolling the shoulders forward. We start seeing these humpback type of presentations, both men and women, and that causes compression and overstretch, if you will, of the nerve roots and the like. This Wednesday evening, the 14th, our presentation in office, our continuing education program, will be on carpal tunnel, repetitive stress injury, arm, shoulder, hand pain. Love to have you there. Truly, these things are fixable. These things are really straightforward when you understand the mechanics of what's going on. Please be our guest. All you need to do is get on the phone and call 703-698-7117. It's our gift to you, and we'd love to have you. And remember, once we have a full class, that's it. And don't miss this opportunity. Dr. Harlan Browning is your presenter, and those of you who know him know that he is top shelf and amazing when it comes to putting the linkages together. This is quite apropos, Doc, because last week you and I attended a class on upper extremity problems. And as far as I'm concerned, probably one of the most brilliant people, Dr. David Leaf, in our community of docs throughout the world. And I was watching some of the things that he was doing, and the common mistakes that many practitioners make in trying to diagnose these types of conditions. And where you go to an orthopedist or a neurological guy, they don't even do what we do to try to understand the mechanics. You have to test muscles, and you have to test them properly. You have to see which muscles are compensating for other muscles that are causing the system not to fire properly.
Yeah, so the take-home thing that I think is very important about the diagnosis of these is, first of all, we need to determine if there's some sort of weakness or impairment that's progressing. That's when it becomes a serious situation. Numbness and tingling in itself is kind of a gray area. We don't know exactly what to make of it, but once we start to develop weakness and atrophy, like in your scenario when you were in chiropractic school and you saw that pad of your thumb getting smaller, we know we have a large area that's compressed. So we need to be able to assess those muscles that are surrounding that nerve. So that really pinpoint muscle testing that we saw last weekend with Dr. Leaf is extremely important, because muscles help other muscles out. So if we just grossly check a muscle for its strength, we're going to miss it if it's not tested in the right way. And if we miss it, we're going to miss the diagnosis, and the person's not going to get treated accordingly, and their problem is not going to resolve.
You get people who play the piano. You have people who play different instruments, the guitars and so forth. Forget about just the home labor. The athletes, as I call athletes in the home. We're out doing things in the yard and so forth. Postural patterns, the ability to make muscles work properly and not compensate one to the other, is so critical in diagnosing these types of conditions. That's why over time, it's more of a timeline situation. We get lazy, we forget, we don't exercise, we don't work out, we don't understand what it is that we're doing slowly over our own timelines that will cause us structural damage like what we're talking about. And it happens so slowly, so insidiously sometimes, that we have no clue. We're going to come up to a break, and when we come back, there's a question from a caller last week that I'm going to answer, and we're looking forward to your calls today at 888-630-9625. My guest in studio, your host this Wednesday evening, the 14th of the month at the Roselle Center for Healing, Dr. Harlan Browning. Don't go away. We'll be right back.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series Video on Demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're in studio on this absolutely amazing Mother's Day in Washington, D.C. Give us a call, 888-630-9625. That's 888-630-9625. Happy Mother's Day, everybody. I hope you're having a wonderful day as you deserve, and people are honoring you as they should. My guest in studio, Dr. Harlan Browning, your host, your presenter, this Wednesday evening, the 14th of May at the Roselle Center for Healing. Love to have you as our guest. If you'd like to find out more about why your fingers are numb and why you can't hold on to things or your arms are weak, this is an opportunity. 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to be there, that you'd like to attend, and I promise you, as many of you already know, you're going to hear more than you could possibly imagine. And I'd like to let you know that Ageless Health 2014, the website is up. We have great discounted prices right now till about the middle of June. So if you want to register and save a whole lot of money, and basically we're losing money on these prices because we want you there, we want to educate you, go to our website, rosellecare.com, or go to drtomroselle.com, and there's a vanity site, Ageless Health 2014, I think, .com, and register and take advantage of it. And if you want more information, you can give us a call, same phone number. Dr. Harlan, I want to talk about something because I promised a guy, he hasn't called in, but I want to give him the information. Last week, a gentleman called, and he asked me a question about guinea hen weed, and he said that it cured his gout. And I had to sit there, bold-faced, embarrassed, and said, I don't know what guinea hen weed is. I'd never heard about it. Well, I subsequently promised him that I would do some homework and research, and I did, and I've studied, and this is an amazing herb. It's huge. It's also called Pativria, Alacia, and Anamu. And it's an herb, it's not just a Jamaican herb, as he put on the screen, but it's one that is grown all over South America. It actually grown in Florida, Arizona, and it's kind of an interesting creature, and it's used for many different things. He said it cured his gout, but guess what? it's listed for everything except for gout. I couldn't find gout anywhere around the area, but all across the Caribbean particularly. It's grown in Africa, South America. This is an amazing herb, and it's used and it's being studied at different universities throughout the world for cancer, and it's been shown to cure cancer and candida and yeast infections and all kinds of very difficult, hard to control infection processes. The active ingredient in it is something called DTS. DTS means, if I can remember, it's dibenzyl triphosphate, and it's an element that they've used in, as I said, various types of cancers. University of Hohenheim in Germany has done a very specific approach to things like neuroblastomas and breast cancers and sarcomas, which are fibrous connective tissue cancers. And the results are amazing, and it's out there. The thing that I would have to warn anybody that wanted to try it is that make sure that you get the organic form, and they do make an organic form because I checked that out too. And Dr. Browning, we're going to get some in the office. We're going to start testing it.
Does it mention in there if it's the leaf, the bark, or the root that they use for the product? Because I've never heard of it.
They've actually been doing studies on all of those pieces. But it seems to be that it's the leaf and the stem that's the one that's the most effective that they're doing the work on. They're also using it for sexually transmitted diseases and so forth. And this is an amazing thing. If this thing is half of what it's cranked up to be, there's some merit here, which means at some point it's going to be illegal to get. Like everything else, when something works, they take it off the market and put it under type A prescription.
Yeah.
So, but we're going to get some of the organic compounds, and the antioxidant form of this or application of the thing is huge. So anyway, thank you, my friend, for telling me something that I didn't know about, but I do know about it now, and we're going to know much more about it as time goes on because we're going to get it, we're going to test it in the work that we do. Give us a call, 888-630-9625. That's 888-630-9625. My guest, Dr. Harlan Browning. Dr. Harlan, let's talk a little bit more about what happens. Somebody goes in, traditionally doc injects and he puts steroids, or they start cutting. Why does that make it worse and almost impossible at that point to fix permanently?
Well, most of the time the reason it makes it worse is because the diagnosis of carpal tunnel was not correct. So if you go in there to try to fix something that's actually not broken, chances are, because there's structures in there very, very tiny, you're going to make it a little bit worse. The issue being is when we cut a tissue, be that our skin or our ligaments or tendons or bones, when we re-heal, there's always going to be a certain degree of scar tissue or adhesions that form. Some people lay down more scar tissue than the other. The problem is in that carpal tunnel, since it's a limited area, if we lay down a little bit more adhesions than we would like, then the problem doesn't go away. So those are the folks that say, I had the procedure, it felt better for a month, and then it came right back. So you better be sure before you cut on what your diagnosis is.
Yeah, and they fix it by cutting what looks like a very hard saran wrap type of band around the wrist. But we're going to talk a little bit more about that and get into some more of the whys, and we're going to trace it further up into the shoulder. We'll be right back after these messages.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle web store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle web store on Amazon.com today. Visit drtomroselle.com and click on Roselle Web Store. That's drtomroselle.com and click on Roselle Web Store.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. Yes, we are in studio on this absolutely amazing Mother's Day in the Washington metropolitan area. I'd like to invite you to save a date and register early. Ageless Health 2014. General registration's up and ready to go. Go to rosellecare.com. That's ROSELLECARE.com and register. It's October. I think it's October 19th. And this is an event that if you haven't attended before, and remember, we change the information every year. We're over the top with the presentation. Dr. Browning will be there. He's going to present. Our entire staff takes a segment. You start out early in the morning with demonstration of core training exercises while you're registering and showing you how you can do something any place, anywhere, anytime. Then I'm the keynote. I kick it off, and we're going to give you tools this year that you can put together to really make a huge difference in your life. There's two different levels of registration. One's general seating, the other one's VIP. General seating and VIP, you get organic free lunch, you get the notes, you get registered for a $1,000 special gift. And there's a gift bag with all kinds of great things from different vendors. We'll have vendors there. Demonstration at noon of Tai Chi, Chinese martial arts. It's a phenomenal day. Please join us. Love to have you there. Go online, check it out. All you need to do is go to RoselleCare.com. That's ROSELLECARE.com. RoselleCare.com. Register now because these early registration prices will only be here for a short time. Love to have you. Enjoy the day. You'll go away and say, why didn't I do this before? Susan, thank you for holding. How can we help you?
Yes, I have in my left hand the index finger and the finger next to it. Only the top is numb, and my right hand, it's only the index finger, the top, and it's only the top of it numb. What is it?
Susan, how long has this been going on? This is Dr. Browning.
Okay. It's maybe only this winter.
And you've never had any of this even in the past?
No.
Okay. You don't have diabetes, do you?
No.
And you don't have any inflammatory autoimmune type situation, do you?
Like what?
You don't have, there's no MS, you don't have rheumatoid, any of those types of things?
No.
Okay. So if it's happening in both hands, I would strongly suspect that it's probably coming from further up in your neck. There's an outside chance that it could be compression in both wrists. Not as likely. And when a lot of times when we get numbness just at the tips of the finger, I actually, the first thing I start to look at is some of the biochemical things. So blood sugar would be one of those. There's no diabetes?
No.
Okay. So again, neck area, the carpal tunnel area, and then sometimes the nerve itself, which is called the digital nerve that goes to the finger, can become damaged over time. You're retired, or you still work?
No, I just retired.
What kind of work did you do?
I'm a doctor.
So did you use your hands a lot?
No, I wouldn't say that.
Do you have...
Average. No, but you know the thing that I don't understand is when it hurt, I used to wear in the winter. I wore gloves, and when I wore gloves, it was okay.
So what kind of gloves were you wearing?
Wool.
You mean just going outside? You were wearing gloves?
No, in the house, because it hurt me also when I was in the house. So I figure maybe it has to do with rheumatism or whatever, or arthritis. So I put on gloves, and when I did it, it didn't hurt anymore.
Do you have any coldness in your feet as well? Do you have any numbness in your feet?
No.
Okay. So if the glove helps, I suspect that maybe there's a possibility it could also be the blood supply to the tips of your fingers. Maybe just by wearing the glove that you're actually warming up that tissue. Dr. Tom, what's your thought on this?
Well, as you're talking about, you're having the numbness occurring. Based on what you're telling me, Susan, I think it's coming from your neck and the upper portion of your back. What happens over time, particularly as a doctor, if you're working close, over people all day long and looking at charts and writing and so forth, you're going to strain the brachial plexus, and those are the nerves that we're talking about that go to the hands. The thumb and the index finger is cervical 5 nerve root, and then you go into cervical 6, which is half of the index finger, and then the middle finger, and then half of the ring finger. So based on where it is, you can have sensory loss or you can have pain, or you can have both. It doesn't make any difference. But in the situation that you're describing, obviously how you could determine which one it is that you would test the muscles of the hand. You'd see which ones were weak. You would do a dermatome tracing with a pinwheel and see what shows up. And then you go up and you test the muscles that are associated with that. For example, the biceps muscle is associated with cervical 5 nerve root. The anterior deltoid is cervical 5. Then if you go to the middle deltoid, that's cervical 6. So you would test not only the hand muscles but other muscles that are associated with those areas. And then if you get consistency either of sensory loss or of muscle weakness, then that would give you a bigger clue where it's coming from. So one of the things that I would try is just to see, for your own observation, is go into a doorway and put your hands on either side of the door frame. And it's one of Dr. Browning's favorite exercises he has patients to do. And as you're facing the opening in the doorway, stretch your shoulders out, and then do that and hold it for a count of maybe 6 or 7, and do that a few times. And then the other thing that you can do is try to get your hands on your hips, palms in the back portion of your hip, bring your chest up and stretch your shoulders backwards and open up that area as well. See if that makes a difference. If those things begin even to make a difference for a short few seconds or a minute or something of that nature, then it's telling you that the problem is further up. It's up into the spine. It's up into the shoulders. It's into that shoulder girdle mechanism, and that's where it has to be treated. But that's what we would do if you were in the practice. We would look at you, we would make those determinations, and then we would treat accordingly. It's not just in the hands, and that's what we're trying to point out today in today's program. It can come from any one of those areas. Hopefully that helps. If we can, be to guide you even further, Susan, give us a call. Love to talk to you, and also love to help you. If you're free this Wednesday evening, join us. 888-630-9625. That's 888-630-9625. Bernice, thanks for calling. How you guys doing out in Arizona?
Oh, we're doing really good. It was a nice day today.
Happy Mother's Day if you're our mother.
Yes, thank you. I am a mother. I wanted to ask, I had a thermography test done about 2 months ago, maybe February, 3 months, and it showed a little inflammation down there, and I was looking it up on the computer, what they wrote down, and I was thinking about, it sounds like IBS, because when I drink milk or certain things, it hurts, on the bottom of my stomach. And so what could help IBS if that's what I have?
What could cause it?
Well, yeah, what causes it and what can help it?
Oh, well, irritable bowel syndrome can come from many different things. It can be a lack of intestinal flora. It could be an allergic reaction. One of the things that's primary that causes intestinal tract problem in today's world is sensitivity to any type of gluten or even grains. If there's abnormal bacteria living in your gut, anything from a Klebsiella or even a low-level C. diff, which hopefully you don't have, those things can cause a problem. Inflammatory responses can come about just because of allergies, high levels of mold and yeast. And, the list really goes on. If you're not producing enough digestive enzymes in the upper portion of the digestive tract, it's not doing its job, so you have food that is sitting there that is not being properly broken up and then subsequently absorbed. So it's very difficult. Treatment is based on what those things are neurologically. So, when you look at anything, you look at all the pieces. The intestinal system has neurological tracts, and they come from the low back generally, although the upper portion of the nervous system, the cranial area. There's a nerve called the vagus nerve. It's the longest nerve in your body, and it goes all the way through. It touches the lungs and the heart and the stomach and the intestinal tract, and some authors say even the upper portion of the bladder. And if that nerve is irritated, then you're going to have irritability and inability of the body to digest and work properly. The acupuncture system as well. So you look at all those pieces. Treatment is based on what you find that is specific, not generalized. You don't want to just put the fire out and even throw an herb at, well, let me try this might work. There's great herbs. I mean, you can use things like getting a good probiotic and trying that and see if it makes any difference. Go to a good health food store, ask them for an organic form of probiotic, make sure you're not allergic to it. If it's dairy, you got to get a different source. If it's a soy substrate, you got to get a different source. But find one that you know that you're not going to have any trouble with. Take it repetitively throughout the day. Cat's claw, also called uña de gato. It's from South America, and it works very well with digestive problems. Pariarco, also called Ipsiro or Lapacho. That's an herb that is an autoimmune stimulator and works very well with that sort of thing. Hey, you can even use that herb that we talked about today. Seems to be across the base, Guinea henweed. It seems to work on everything. If you do that, and I'm not telling you to use it because I don't have any experience on using this thing at all. Try a cup of tea, see if it works. But the thing of it is, it has to be directed to the source. If you were in our practice, we would check multiple things to see what really is showing up, and then we would treat that directly.
Okay, and where do you get the tea? The Guinea?
Well, we found several sources. One's a professional source. Go online. It's easy to find. There's tons of information out there, and I didn't even realize it because I didn't know the thing existed.
Uh-huh.
But look Guinea henweed or look under Petivera. See if I can remember how to spell it. I think it's Petivera, Petivera, Alacia, ALLIA, I think, CEA. Anyway, it's under those names, and but only buy organic herbs, because if you don't, you run the risk of toxins and pesticides and all those things, and that's not good, and you're dealing with something else. So as I learn more about this thing, I will post it, I will blog about it, and I'm going to use it in the practice as well.
Is there a test that I should ask the doctor to test for IBS?
Yeah, hi Bernice, this is Dr. Browning. You want to find somebody who does some functional medicine, and there certainly should be a lot of people in Arizona. Where are you located?
Near Tucson.
So if you go to the organization we belong to, the International College of Applied Kinesiology, you could probably find a practitioner out there, and they would most likely run something called a comprehensive stool analysis, which looks at how functionally well your digestive tract is working, everything from bacterial levels, good and bad, to parasites, to markers of inflammation, markers of digestion, and they also check for sensitivities as well. So if there's a bad bacteria in there, they'll give you some hints on different herbs that would work well for it, because they specifically check the sensitivity. So
Bernice is actually a great doctor in Tucson. It's a good friend of Dr. Browning's and mine. He's one of our teaching diplomates, past chairman of the International College of Applied Kinesiology. His name is Dr. Sheldon Deal, D-E-A-L, and I think the name of his center is the Swan Health Center. Okay. But anyway, his office, and I think his family's involved. Great practitioners. I'd have no problem sending my own family there, so you can check them out.
Okay, thank you.
Bernice, thanks for calling. Appreciate it. 888-630-9625. That's 888-630-9625. Love to talk to you. My guest in studio, Dr. Harlan Browning. Your host, your presenter, this Wednesday evening, the 14th of May at the Roselle Center for Healing. He's going to be talking about the subject we're on, which is things that make your hands not feel so good, numb and tingling, loss of strength. And it can start anywhere from the neck, shoulder, elbow, all the way down in the hand. Join us. I mean, it's an opportunity. He'll answer anything that you have. He's great. He understands neurology probably better than 10 people. So he'll be able to trace it and give you an insight, but not only an insight to what's causing it, but also how to fix this thing. All you need to do to attend is call our office at 703-698-7117, just so you know where we're at. If you take the National Capital Beltway, Arlington Boulevard, and we're probably a half a mile off the Arlington Boulevard exit, right in the Red Cross building. We're on the third floor, and we have a beautiful facility. If you haven't seen it, come and see it. Come and say hi. Join us. Dr. Browning, let's talk a little bit more about this crazy subject that you and I see almost on a daily basis, unfortunately. And let's talk about how it affects strength, because a lot of people, don't get pain. They get loss of sensation. They're not even aware that they've lost the sensation because it's not tingling loss, but it's a dampening of it, and they can't grab things the way they should.
Yeah, so very common. People will fumble things, or they just don't feel right, or they will describe that their hand just feels weak, and unfortunately, unless you specifically test those small muscles of the hand, it's really hard to discern if a person truly has weakness or not. But if we're starting to get weakness, then you need to start to look at if the person's developing atrophy, if the muscles are getting smaller. So one of the things that everyone should do if they're having any sensation that's abnormal in their hands is just look at them and look to see, do the muscles look equal from right to left? Does the color of the skin look equal right to left? If there's differences in one of those two, then chances are that compression has been there for a little bit of time, and you need to do something sooner as opposed to later for that.
So here's a question for you. A lot of patients come in, and the question's for our audience, obviously, and they're diagnosed with Raynaud's, and they have a problem with temperature changes of any kind. Can this be a carpal tunnel presentation or a neck, shoulder, arm problem instead of a vascular degradation?
Certainly. It certainly could be. And in many cases, the symptom pattern with carpal tunnel is a little bit of the numbness and a little bit of the coldness in the hand. With folks that have Raynaud's, then you need to see if they have an undiagnosed thyroid problem, regardless if their lab values look good. And so the doctors will run a TSH. This is kind of just a broad brush marker that our thyroid is working. It doesn't necessarily tell us unless it's really out of range how well it's working. So a thyroid problem will do that just as well.
The point I want to draw here is that just because you have a numb finger or you have a loss of strength in your hands, it's not necessarily emanating from the wrist or the arm. It can be from other different areas of the body that represent and present themselves in the hand. And a diagnostic evaluation has to be specific and has to incorporate all these things. And if that hasn't been done, and just take this drug and call us a week or month or a year from now and we'll see what it is, it's not okay. We'll be right back. We have to take a break for some very important messages. You're listening to Dr. Tom Roselle Live. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live in studio. Happy Mother's Day again, everybody. Make sure they take you to the park or brunch or for a walk, but make sure they celebrate you today, ladies. I mean, you are the stabilizing force behind everything that we are. And don't let anybody tell you otherwise, because you are. This Wednesday evening, Dr. Harlan Browning will be your presenter, your host at the Roselle Center for Healing. He's going to be talking about not only carpal tunnel problems and other elements that make things go numb, but anything that affects that area. What do I mean? He's going to talk about the blood supply to it. He's going to talk about the nerve supply to it. He's going to talk about different types of lifestyle conditions. But more important, he's going to teach you how to fix it. So if you have problems with your hands and your arms and you find them going numb, not being able to pick things up, not being able to do the things that you like to do, how about even playing a sport because you can't hold on the racket anymore, or you can't hold on to the golf club, or you can't hold on to a cup of tea and go out with your friends because you can't feel it. Guess what? You got a problem, and he's going to show you how to fix it. Dr. Browning, let's get into a couple minutes of really what that class is all about, why we do those classes, and how people can benefit by being there with you this week.
Well, I think the overlying theme of any time we do one of those classes is obviously to educate the patient and the population about the choices that they have to take care of their problems and certainly what causes it. So if you've ever been to one of my presentations, and I know you have, Dr. Tom, we're going to spend a lot of time talking about the why behind the causes of the issues, and then we're going to trace those symptoms, and we're going to follow them back up to make sure that if you have numbness in the hand, that it is coming from the hand, or maybe it's coming from the neck. And then we're going to look at some diagnostic tests that I like to utilize to help figure out if the problem is truly from the wrist versus the neck. And we're not talking about very invasive things like nerve conduction velocities where they're putting a large needle into you. We're talking about some very specific functional office tests, different muscle tests that can tell us what's going on. And then certainly we go through all of the things that we're going to do to fix the problem, and more importantly, make sure it doesn't come back. Because the majority of folks that come in with these types of problems also have it because of overuse. So if you don't change the over portion of the use, then the issue is going to most likely sneak back in there again if you don't change habits.
It's a great presentation. Trust me, you're going to learn more than you ever thought possible, but more importantly, you're going to learn how to do things, not only to fix it, but to prevent it. And he's going to be there to answer any question that you have. He'll stay. He'll do a mini consultation with you and tell you whether or not something can be done or there's other options. It's this Wednesday evening, the 14th, 7:30 p.m. at the Roselle Center for Healing. Call us, 703-698-7117. Tell my staff that you want to be there, and we'd love to have you there as our guest. Remember, these are free. There's absolutely no charge. The only thing they're going to ask you for is a phone number so they can confirm and make sure that we have enough seats, because once they're gone, and then it's all done until maybe next year when we do them again. Save the date. Don't forget, Ageless Health 2014, and it's called Proven Tools to Maximize Your Health, and it's an all-day event, October the 18th. It's a Saturday. Starts early, and it goes to 5 o'clock in the afternoon. It's the Fairview Park Marriott Hotel. You get lunch, an organic lunch. You get to meet with the docs. We'll be talking to you. And so let me ask you a question. Are you ready to take control of your own health? Are you ready to step up to a much larger, greater level of wellness than you ever thought that you could possibly have for you and your family? This is an opportunity to get you there. These are tools that you can implement immediately and make a huge difference in your life. So why don't you step up, go to rosellecare.com, that's ROSELLECARE, and register, because you're going to save some money if you do it now. Later on, it's going to cost you more. We still want you. We're still going to have some seats available for you, but guess what? If you do it now, the savings is significant, so don't waste. We're here every Sunday, 12 o'clock noon, giving you the most intimate and controversial information on integrative and alternative health care. That's why we do what we do, because we love you. And we're always going to do it. We're always going to make you think. Do your homework. Step up to the plate. You're in control. Health is a do-it-yourself program. See you next week. Bye.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.
This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.